Hello, everyone. Welcome to today's class. I'm Boss Celestina. I will be your anchor for today's session. I thank you all for coming on time, okay, for the class. So, today, what we'll be looking at is infusions and the parenteral therapies. That's the topic for today. Infusions and the parenteral therapies. We have been handling infusions. There's no day you go to hospital without seeing what? A client who is an intravenous infusion. Okay? Even if you don't notice parenteral therapies, even if you don't see those ones, okay, quite often, but for intravenous infusions, these ones, you almost see them on a daily basis. All right. So, what is intravenous infusion? Intravenous infusions, these are what? Liquids, fluids that we deliver as medications, electrolytes, or nutrients directly into a patient's vein through a needle or catheter, intravenous infusions. They are liquids or fluids given to clients via their veins, okay, intravenously, either through a needle or a catheter. These fluids can be medication, it can be electrolytes, it can be nutrients. So why do we give clients these medications, electrolytes, through IV, intravenously? It's because if you deliver the medications or the electrolytes through this route, there will be rapid absorption of the substance, and there will be what? Rapid onset. The thing will start acting immediately. So we have rapid absorption for rapid effects. There's also precise control over dosage. Because you give it via what? Electronic infusion pump, you are able to do what? To give the accurate dosage. You can also control it, the flow. Intravenous infusions helps us to hydrate the client. We use it for hydration, to support blood pressure, and also to maintain electrolyte balance. Indications. Why do we use intravenous fluids, infusions in the healthcare facility? Or what are the indications, conditions of client that warrant us to prescribe? That warrant us to prescribe intravenous fluid. Fluids and electrolyte deficits, medication administration, nutrient supplementation when client needs additional nutrient. The one client is taking is not enough. The one client is taking orally is not enough. Emergency care, we need the infusions. Critical care, we also need the infusions. Hypotension, we need the infusion. Anaphylaxis, surgery, and other health in wound dressing. We use some infusions to irrigate wound. We also use some infusions as what? Dressing solutions as well. So we have a lot of conditions where we need what? Infusions, where we use infusions, okay? Intravenous fluids can contain various substances such as what? Saline solutions. We have dextrose. These ones, we call them crystalloids. When infusions contain saline solutions or dextrose, we call these ones crystalloids. Infusions can contain antibiotics, Chemotherapy, cancer medications can be in infusions. Vitamins and minerals, we have colloids. Colloids are what? Albumin or starch solutions when they have them in infusions. We call them colloids. Saline solutions or dextrose, we call these ones crystalloids. Okay? So infusion helps us to restore fluid balance. It helps to support organ functioning. It also helps to promote overall health of a client. So whenever we are administering infusion, close supervision is required to ensure safety administration as well as for effective treatment. Types of intravenous fluid. We have the isotonic solution. We have the hypotonic solution. We have the hypertonic. We have isotonic, hypotonic, and the hypertonic solution. Normally, the intracellular and extracellular compartments in our body have what? Fluid and electrolytes that have equal concentration and the osmolarity. The intracellular compartments and the extracellular compartments have fluids and electrolytes, and they have equal concentration and osmolarity. That's why we don't have shift. That's why we don't have movement of fluids and electrolytes from one compartment to another. But when there is a problem, disequilibrium due to disease condition, dehydration, shock, okay, or hemorrhage, this will cause the fluids and the electrolytes to do what? To shift. And they normally shift from where? Area of lower concentration to area of higher concentration. As a result of that, there will be need for intravenous infusion. Okay? Isotonic solutions. Isotonic solutions, if you infuse them intravenously, they stay in the IV. We don't have movement here, unless if there is what? Disequilibrium. They stay in the intravenous area. That is where they will be. Okay, that is the site they will be. Isotonic solution. If you introduce it IV, it remains there. There is no fluid shift. Okay, because the solute in the fluid, the osmolarity, the concentration of the solutes are the same with the ones we have in our body cells and the blood. So we don't have movement here. So when you put them in the blood, in the vein, what they normally do is just to do what? To increase, to expand the fluid volume. Okay, they will be in the vein and do what? Increase the fluid volume. We don't have movement. So that's why when you give client isotonic solutions, most of the times what you will see, what you notice is what? Slight elevation of blood pressure. And we have examples: 0.9% normal saline. We have 5% dextrose water. Ringer's lactate. Any question? All right, then we have D5 water in 1/4 normal saline. These are examples of isotonic solutions. Remember, they have the same concentration. The solutes, okay, have the same concentration with the body fluid. As a result of that, they will remain in the vein, in the blood vessel. It's not only the vein, in the arteries, the blood vessels, they don't shift. Indications: in which condition can we use isotonic solution? In nausea and vomiting, in burns, when there is hemorrhage, when there is dehydration, then shock. We can infuse isotonic solution. For hypertonic solutions, in hypertonic solutions, the fluid, okay, the solute contained in the fluid higher osmolarity.
Already I asked her, she said no. She said no. Yes. Already I asked before, that when you told me to ask. She's sleeping. She told me no.
So for hypertonic solutions, the solute contained in the fluid has higher osmolarity than the ones contained in the cell and the blood. So these hypertonic solutions, they cause fluid shift. When you infuse it into a patient, it tends to draw fluid away from the cells because it has higher concentration. Remember what I said? It will pull fluid from the cells, okay? Blood vessels that have lower solutes, lower osmolarity, lower concentration, and pull it to the fluid, okay? Example, we have dextrose, 10% dextrose water, 3% sodium chloride, that is normal saline, 5% normal saline. We also have D5 water in lactated ringers. Remember that ringers lactate is what? Isotonic. But when you add it 5% dextrose water, it becomes hypertonic. We have mannitol. We have D5 also in normal saline. We have albumin. We have TPN. These are examples of hypertonic solutions. For mannitol, whenever you are infusing mannitol, make sure that the tubing you are using, okay, has what? Filter. Because mannitol forms crystals when you store them at low temperature. They can form precipitates. They form crystals. So you need filter that will help to do what? To trap those crystals so that they don't enter into the client's vein. Okay. Indications. In which conditions can we use hypertonic solutions? We use it especially in clients that have what? Fluid stored in the third spaces. I hope you remember third spaces. Okay. For example, when a client we have a client with pleural effusion, pericardial effusion, ascites, okay? When you have fluid trapped in areas, spaces that are not supposed to be, in the joints and so on, in the brain. So we use hypertonic solutions to manage these conditions. Edema, burns, ascites, also hyponatremia. Remember we mentioned 3% normal saline. You can use it to do what? To correct hyponatremia, okay? Then the hypotonic solutions. Here, what happens? The fluid contains less solutes, lesser solutes than the content of the cells or the blood. So the fluid you are infusing has lesser osmolarity, lesser concentration. And remember what we say, fluid will pull from it will draw fluid from the area that is lower to area that is higher. So this fluid now you are infusing the hypotonic solution, they will move. After putting them into the veins of the client, they will still move out of the veins and move into the cells because cells are drawing them. The content of the cells are higher. So the fluid will still move out of the veins and enter the cell, okay? Examples, 0.45 sodium chloride, 0.225 sodium chloride, 0.33% normal saline, 0.5 normal saline, and then 2.5% dextrose. So these are examples of hypotonic solutions. Where can we use hypotonic solutions? We can use it in hypernatremia. We can use it in cardiac disease. We can use it in renal disease. Remember what is happening here. client is already having a hypertension due to fluid overload. So if you are still putting fluid inside the client's vein, inside the client's blood vessel, okay, you are adding a more problem. Unless if your client is having issue with what? Blood pressure, maybe it is low. That is when they can put isotonic as a maintenance dose. It will just be dropping small. Then we can also use it for fluid replacement. All right. Drip chamber. What is a drip chamber? It is a component of an intravenous infusion set. It's a component of an intravenous infusion set. It is that plastic or the glass container we see that fluid drops into. When you puncture the bag, okay, that transparent plastic or glass container that the fluid enters before it now moves into the tubing. That's the drip chamber. What is the function? It allows visual monitoring of the intravenous fluid, the flow. You will be seeing it. It regulates the flow rate. It prevents air bubbles from entering the bloodstream. As a healthcare professional, that drip chamber will also help you to adjust the infusion rate, because if you see it dropping very fast, it is not transparent, you will not know how the drops, okay, the number of drops that enters in a minute. So because it's transparent, it helps you to know when it's dropping so fast, and you'll be able to adjust it. It will also help you to detect potential issues like presence of air bubbles or blockages. Okay. It is an essential part of IV therapy. It ensures safe and controlled delivery of medications or fluids, the drip chamber. So this is what we call the drip chamber. We have different sizes. Okay. So fluid drops. When you puncture it, fluid drops in here, and you'll be seeing how the thing flows, whether it's rushing or dropping minimally or moderately. Okay. You can also count it to know how many drops that falls in 1 minute. So all these are what? Drip chambers. All right. Let's continue. Types of drip chamber. We have the micro drip and the macro